Thank you, Kavita, and thank you, Sarah. Kavita, we really appreciate your being out here today and helping us with this event for ICAN. And I am gonna, Kavita, you mentioned about women, and this is one of the most important things that we want to solve in Sri Lanka, because Munira grew up in Sri Lanka, my co-founder and wife of 30 years, and she's had experiences in Sri Lanka that have limited. She herself had limited opportunity when she was growing up, and that's true even now. We have vast numbers of university graduates, vast numbers of highly educated people who have a lack of opportunity. So, Sri Lanka is a very unique country. It's got a literacy rate of 96%. Now compare that to India next door, which is at 49%, or Pakistan, where I come from, is at 34%. The university entrance is very competitive. It's like people work very hard, and they place a lot of emphasis of getting into university. My own alma mater and many of yours is Stanford and MIT, and these very fine elite universities admit about 15% of all applicants. And can you believe that the entire university system of Sri Lanka admits only 12% of all applicants? So they graduate about 10,000 people a year, and there's about an equal number of women and men. But at the end of the day, there's just not enough jobs to absorb all these bright young kids into the economy. And so there's a huge unemployment among young people, university graduates, and female unemployment is almost double that of males. And 13% of the entire workforce of Sri Lanka goes overseas to work, and in low-level jobs in the Middle East and other places. And they, in fact, some of our team members have met in Singapore. They were based in Singapore, and they had a maid that was university trained. Can you believe a university trained person in a job? I love maids, but this is not a good use of human resources. And so this is the problem. This is one of the problems that we want to solve. That Munira's vision is to help her country and help these young people. Now, a little bit about myself. I've run a home health agency, a home nursing company for the last 20 years. I started it and ran it and grew it to 12 branches in 6 states here. And all that time I was constantly, I was highly constrained by the lack of available nurses. And there wasn't a day that passed that I was feeling, gosh, I wish I had another nurse to see that last patient. And so, I realized that during that tenure that this is a problem that is throughout the United States. And for the future of the United States, the Department of Health and Human Services predicts 1 million nurses short. This is 1/3 of the entire nursing workforce by 2020. And as you can see, there's a huge demand due to aging population and medical complexity increasing. And at the same time, we have a slight decline in the supply. And can you guess at the average age of nurses today? Can you, Tom, Indy, what do you think? What's the average age of nurses today?
I'm going to guess 37.
Okay, well, it's a little off, and they're closer to 50 today. And so these people are starting to retire, and at the same time, hospitals pay a lot of money to nurses because of the shortage, and so there's no incentive for nurses to go on for master's and PhD levels to become faculty in nursing schools. And so that's why there's a shortage of teachers, and that's creating a shortage of slots for training nurses in schools, and also the hospitals have a real problem allowing too many students for training. And of course, you probably know that nurses, you have to have hands-on training. It's not possible to have them trained on computers and machines. They've got to have hands-on. They've got to know the people, the pallor, the heart rate, the pulse, and so on. And so it's very important to have training in hospitals. So these are the reasons that the nursing shortage, and the WHO, the World Health Organization, says that this is a major crisis that's facing us in the next couple of decades, around the world. And as countries like India and China develop and the middle class increases, they're demanding more and more healthcare, and so they're demanding more healthcare workers, and the United States and Europe and Japan and so on has a great need as well. So ICAN, we brought these two problems together. From my experience in healthcare and Munira's experience growing up in Sri Lanka, we hope to bridge these two problems by retraining underemployed and unemployed women graduates, and by establishing a nursing school in Sri Lanka and focusing on accelerated nurse training, and then alleviating the nursing shortage in the world by matching these graduates to healthcare employers around the world. So our business model is very simple. We start with a pilot program which costs $2.5 million. We train nurses, train our students at a cost of approximately $5,000 per nurse, and we place them with hospitals who pay us a $15,000 placement fee on average, and the students pay us tuition, which is an average of $50,000. Now I want to tell you a little bit about our tuition model, which is one of the innovative things we've done. And so the tuition is completely deferred until the students graduate and get a job. And they pay us then 10% of their annual earned income for a maximum of 10 years and up to a maximum of $60,000. So the amount depends really on the opportunity that they choose. If they come to a high-paying country like the United States and get a job at Stanford or UCSF, they're going to pay us the full amount, probably. But on the other hand, if they choose to stay in Sri Lanka, or they choose to go to Africa and work at a social job, then they can, they may pay us very little or nothing at all, because we will waive their tuition payments if they're making less than $10,000 in a year. This allows choice of social jobs as well as